ABC's Dr. Richard Besser and Martha Raddatz as well. Our own little round table here in the morning.
Yeah.
You saw the video.
That's right.
What did you see?
Yeah, okay, so let's look at that video. You can see that she's leaning on a post there. The door's open. She goes to get into that video there. She's supported under her arms. Her feet come up off the ground, and you can see that she's not able to walk in on her own. And when you see something like that, it could be caused by any number of things. But what's reassuring to me as a doctor is the video 90 minutes later, where she's outside the apartment. She's able to talk with people and greet. And that, to me, is consistent with the story that we're hearing, that she was dehydrated and got rehydrated and was feeling better at that time.
Overheated, dehydrated, and the doctor's saying pneumonia. But, you know, some people are wondering, could it possibly be something more serious?
Well, you know, when you hear the word pneumonia, people wonder what that even is. Pneumonia is a lung infection. It can be caused by bacteria, by viruses, by funguses, all kinds of things. What I'd like to know is, you know, how was she examined? How did they make the diagnosis? Did she have an X-ray? What kind of pneumonia?
Yeah, we used to hear this phrase, walking pneumonia.
Yeah, so a walking pneumonia, it used to refer to an organism called mycoplasma. It was a mild pneumonia. People might not even know they had it until a doctor put a stethoscope on their chest and listened. And sometimes they could go about their day. Certain types of pneumonia are contagious. Certain types need antibiotics and other ones don't. And there's a lot there that, as a doctor, I'd want to know.
And Martha, this gets to the question of disclosure as well. She was diagnosed on Friday. That statement comes out early in the day, says overheated, but doesn't disclose the pneumonia echoes of when you were covering her in 2012 when she had that concussion.
When she was Secretary of State, as Cecilia mentioned, very early in December 9th it was, she basically called in sick to the State Department. They said she's under the weather. What we didn't really know for about 4 or 5 days was that she had fallen. They kept saying she was not feeling well. They canceled the trip, but they gave no details. She actually was diagnosed with a concussion on a Thursday of that week, didn't come out until Saturday, tell us about the concussion. Then she had that blood clot later in the month. They basically said she wants to get back to work, she's making good progress, and then a month later we see her with those glasses. And they did not disclose those glasses were for double vision.
And they made
Somebody caught it by looking at the photograph.
They made a big point at the time that she wasn't hospitalized.
Yes, they said she wasn't hospitalized, but what happens is they bring the hospital to her. They do tests there. They had 24-hour nursing care, but they never, ever said what exactly was going on.
I was going to say, so Rich, as a doctor right now, you're seeing a lot of op-eds by other doctors about what obligation each candidate has to disclose right now. Pretty extraordinary situation. Donald Trump, 70 years old, Hillary Clinton, 68. When John McCain ran back in 2008, he released something like 1,200 pages.
Well, some of the calls in the op-eds are for an independent panel to do a medical evaluation. You can't play professional football or baseball without having a medical clearance, without someone doing a thorough exam who is independent. I don't think that's unreasonable for a president. As you hit your 70s, there are all kinds of medical problems that tend to come up that you see less in people who are young. And people want to know the health status of their candidates. Doctors won't lie when they're talking, but they also won't disclose things without the permission of a patient or a candidate.
And as we said, neither candidate has released those medical records. But after this, and because of the age and what you're talking about,
more pressure.
And brings up those issues of mistrust again for Hillary Clinton, which is such a huge issue in this campaign.
For both sides, yeah.